result of a foreign body reaction, like a glass or a bullet that the body wants to get rid of. It creates a callus around it and pushes it out, right? And I think that's also part of how these blowout fractures happen, right? And so that's what I believe. And if you want to have a consistent aspirate of bloodless fat like this, give us a call. We would love to see you. And this has many advantages to the patient. Less risk of anemia, less risk of hematoma, less risk of infection, less risk of painful nodules. It's just incredible, and we can go on and on and on and on. Thank you. Good morning, Dr. Patino here at the Cosmetic Surgical Center of Costa Rica. We're going to do micro air power assisted liposuction. Notice that I'm using my non-dominant hand, right? And even like that, because we go slow, right? We can do that, and there is absolutely no bleeding because we go slow. So it's safe to do this. You can even do it with your non-dominant hand, even if you're not ambidextrous, right? And you can obtain consistently this yellow, beautiful aspirate, right? But if you go at it real fast, you know, and with aggressive cannulas, and if you don't wait, we waited how long, you guys, before we started?
About 40 minutes.
Almost an hour. How much? Yeah, almost an hour we waited in order to obtain this beautiful aspirate. Look at that, huh? And this is, and I told a patient yesterday, you know, don't even look at my past videos, look at tomorrow's, and look and see if there is any blood loss. And that's the way we do it. You know, this patient is not having a fat transfer, but if she was going to have a fat transfer, guess what? That's the fat that's going to be transferred into her bottle. Of pure fat, not red, not pink. And of course, the fat graft retention is going to be a lot higher, right? Because we're not putting fat and blood. We're putting just pure fat. And by the way, we don't have to purify this fat. So even though this takes me a while to do, our time is very efficient because we don't spend time purifying this fat because it's already pure. You see the difference, you guys? This is incredible. And so there's much less risk of oil into it because also we use an aspirator at very low power. So the pressure, yeah, so now I'm switching to my right hand, and you know, advantages for the patient, right? When you go slow like this, it's like driving a car, right? So the patient has an advantage because what's the risk of me perforating an organ if I go at this speed? It's almost zero, right? And that has never happened, right? It's like driving a car. If you go very fast, you're gonna lose control of the vehicle and go into an unintended area and perforate an organ, something that we never done here, and never had anybody die, thanks to God, and we're gonna keep it that way, right? But what happens is that when you go slow like this, right? Also, and you switch hands. See, I'm switching hands again, right? The surgeon has also benefits because the risk of, let's say, epicondylitis, right, or tendinitis, right, the result of repetitive motion, right? You can have tennis elbow, right, or you can have problems with your shoulders, right, or your tendons, right, from the repetitive, very fast motion that the surgeon has to do. And that aggressive motion, going so fast, can result in bleeding, oil cysts, and even when you do the fat transfer to the buttocks, you can also have a fracture. We call it a blowout fracture, which is like a light bulb basically that comes out of the buttocks, like that, you know. And a lot of it is, you know, I understand it's the destruction of the buttock architecture with aggressive cannulas and tunneling that we don't do. But it also, I believe, Alright, so now we're doing the arm, and we already finished the entire back. We're doing liposuction here, but I want you to see what comes out, okay? Basically, it should be all yellow, beautiful fat. And notice how I am using my non-dominant hand. I'm right-handed, but I'm using my left hand. And you can do these even if you're not ambidextrous, for those doctors out there, because look how slow I go. It's a very controlled stroke. And even if, for example, I'm using the non-dominant hand, if I wasn't ambidextrous, I have very full control of these, right? And look at the yellow output. It's incredible, right? So this is incredible. It has many benefits for the patient. Number one, benefit for the patient that because you go so slow and your strokes are so calculated, there is going to be much less risk of an internal organ injury, right? And of course here, good morning, Dr. Patino here at the Cosmetic Surgery Costa Rica. We're gonna do liposuction to the back. We already did the other side, and I'm gonna, and we're gonna do the arm as well. But I'm gonna show you. See, this is an electrical tool. See, it vibrates. It's similar to a toothbrush, right? So you don't have to be jamming the instrument back and forth because you create much like you do with your teeth bleeding, right? Like you do gum bleeding if you go at it, right? So you just let the tool do its work, right? So I'm putting and you're gonna be the cannula and just gently let the tool do its work. I do move it back and forth, but gently, right? Not at full speed. I would say my speed is way, way, way slower. And as a result, I can predict what's gonna come out, right? I told a patient that I was seeing on consultation yesterday, she's wondering, how do you do this, bloodless surgery? I said, forget about all the videos, the thousands of videos that we've done. Just look at the one from tomorrow. I can predict that tomorrow, I'm not even looking at it, but I can see it's probably yellow, right?
It's yellow.
It is yellow, right?
Yes.
So I'm concentrated on what I'm doing here, but this yellow output is obtainable, is predictable, and I teach it to doctors. How can we obtain this, right? There's many things that go into it, right? So first of it is we tell the patients not to take any aspirin, ibuprofen, herbs, vitamins for about 2 weeks before and 2 weeks after the procedure. We don't give any aspirin-like medications. We don't give any blood thinners at all. We don't give enoxaparin or heparin. And we select our patients. I had another patient that had a blood clot before. I said, I'm not going to operate on this. Says, yeah, the doctor said that she had a prior consultation. Some doctors routinely give blood thinners to prevent a blood clot, right? And that's very good common practice and is considered, very good practice to do. But we never do that. And the doctors that do it, they should do it. And the reason why is because I believe that the best way to prevent a blood clot is not with blood thinner. The best way to prevent a blood clot is to have the patient, as long as the patient is healthy, obviously. If the patient had a blood clot before, no. But as long as the patient is healthy, the best way is to have the patient ambulate, early ambulation or walking. We have the patients walk here in the operating room. As soon as they get up, they walk and they walk home. But they can do that because they don't have pain, see? So if your patient is going to be in severe pain, they're not going to walk. And yeah, definitely, give them blood thinners, right? But you're not going to be able to get this aspirate, this yellow, beautiful aspirate like that with blood thinners. No way. And some doctors routinely give the enoxaparin, which is similar to heparin, routinely give aspirin for surgeries like this, and we just don't do it. And I don't think it's necessary. I know it's not necessary. And it can lead to problems. It can lead to hematoma and bleeding and complications, anemia, etc. So our patients don't get any of that. They don't get bleeding. They don't get anemia. They don't get a hematoma. Much less risk of infection, right? Because when there is bleeding, there's more risk of infection, right? And so also, notice how slow I go. So if I go slow, there is a much less risk of me perforating an internal organ, right? Why? Because It's similar to driving. Like when you drive a car, if you're going at full speed, you may compare these to driving a car, right? If you go slow, like I am, you can still crash, right? But what are the chances? Much less risk. So it's not like there is no risk of bleeding or hematoma or infection. There is a risk, but much less, right? So, and when you go fast, it's the opposite, right? You can go so fast on the freeway that you can, like literally lose the control of the vehicle, right? The vehicle goes to an unintended area, you crash, and it's a problem. So here it's kind of the same thing. If you're going at it, at full speed, then you can have an internal organ injury. You can go to an unintended area, right? That's basically what happens when you hear the people die and they perforated an organ. That's usually a surgeon that's tired already, that's going at full speed, maybe on a Friday afternoon, maybe after doing multiple cases. So we don't do that, okay? We do 1 or 2 cases at the most. We go very slow and we take our time, right? And so that way you can obtain also these beautiful yellow aspirate, because it's similar to like brushing your teeth, right? If you brush your teeth at full speed with a regular toothbrush, there is going to be gum bleeding, right? But if you brush your teeth with like an electrical tool and you just look, I can just hold it with 2 fingers like this, and it goes in, it slides in nice and easy without any significant pressure. So this has many benefits for the patient, of course, because there is less risk of anemia, less risk of bleeding, less risk of infection, less risk of oil cysts that are the result of traumatic, aggressive liposuction, where basically the surgeon breaks the
action.
Yeah, so we collect the fat very gently. This particular patient is not going to have a fat transfer to the buttocks, but we still are very careful. We're very meticulous. We treat the fat cell with care, and so that way also when you do your fat transfer, you're going to have a lot better fat graft retention. Why? Because when we put the fat, it's going to be this yellow fat. Look at this yellow fat right here, right? That's what's going to go into her buttocks, right? It's not going to be blood and fat, because obviously, the fat is going to stay. All right, so we're toward the end of the procedure, and look at that beautiful yellow fat. We're almost done, and many benefits for the surgeon as well. Less risk of repetitive motion injury, like for example tendinitis, like tennis elbow, or like shoulder pain, or even wrist pain, because my movements are very calculated, right? And so this is the best way to do it. Thank you. So we're toward the end of the procedure. This is it. We've got like 3 more minutes, and what is the output on that?
Yellow.
Oh, I'm gonna see it, man. Show it to me. Look at that. Incredible.
Wow.
And look what I'm doing is I'm doing the definition here to the back. Let me show you here. Come over here so I can see. I can show you this. I'm recreating this line here. You see the line that goes in the middle from here. See? So I'm recreating it there, and I'm also gonna give her some lines here on the paravertebral muscles, right? These group of muscles here. So that's what we're doing, and that's pretty much almost done. Thank you.